Hi, my name is Bruce Hoskins. I own the Croton Animal Hospital in Croton-on-Hudson, New York. Thank you for tuning in to our channel. Today we're going to talk a little bit about microchipping your pet. You've probably heard of microchipping. It's a process where we implant a small chip about the size of a grain of rice. It's actually preloaded in this syringe. We insert it between the shoulder blades. Here at Croton Animal Hospital, we ask you to either approve or refuse having a chip implanted at the time of your pet's spay or neuter, because that is an ideal time to do it. Your pet feels no pain, they're under anesthesia anyway, so that's an ideal time, but it can be placed anytime. Usually, we'll discuss it with clients at the time of one of their puppy or kitten vaccine appointments if they would like to have it done. We obviously recommend it because it is one way to reunite you with your pet if they are lost. It works by this little scanner, which looks at the microchip, and when it is searched over the microchip, for instance, there's a microchip in this, it comes up with a 15-digit number. When we see that, that's unique to that pet, and we will then call the microchip company, see who the owner is of record for that pet, and reunite you with your pet. They also give us a sample chip. There's a picture of that's an actual chip in that little reader. And when we hold this up to it, there's your 15-digit number for this pet. I'm going to use our little demonstration stuffed fox here to show you how it's done. We open the kit. We remove the cap. That shows you about how big the needle is. I describe to my clients that it's about the same gauge as a needle that you donate blood through. And usually if we distract the pet with a little bit of a treat on the table, we tent the skin over the shoulder blades, we insert the needle, we push the plunger, we usually pinch for a second or two. There may be a small amount of bleeding there. And then after we are done, we scan, and this fox now has a little chip in it. That chip correlates with the number on the card that you get to take home. It also correlates with a collar tag that is part of the kit that your pet will wear. But what's most important is this is the only identification your pet will have if they lose other forms of identification, like their collar, like their identification tags. This animal, if it's presented to a veterinary hospital, so Good Samaritan outside happened to find it wandering the street, and they said, we don't know who this belongs to, we found this dog. First thing we will do here is scan the animal, and the microchip shows up, and that's when we can reunite you with your pet. One other interesting thing about the placement location is the standard implant site is between the shoulder blades because the chip is radiopaque. That means when we take an x-ray of this pet, it will show up, and it's standard protocol if an animal comes into us injured for all veterinarians to take a chest x-ray. If we haven't already scanned the animal for a microchip, but we see it on the x-ray, we know to get that pet's identification information off the microchip. Thank you for tuning in.